The world just turned so dark. I would just hide in my basement in a corner. I didn't want anyone to be around me. I saw nothing positive in life anymore. Nightmares that turned to night terrors. Then I started sleepwalking. I would wake up drenched in sweat. It just progressed to my extensive suicidal ideations. I tried to block that out with my addiction.
PTSD is a very complex disorder, and often it will mirror with other symptoms and other illnesses. So often the diagnosis is very difficult to reach. So for uniformed workers and first responders, there may be one particular event that they have been exposed to that may be kind of the reason that they develop PTSD. But in occupations such as first responding, they're going to be at risk of re-traumatization, so being re-traumatized on the job.
I was one of the main paramedics at a double murder in Barrie, Ontario. It was with a satanic cult, and the two women that were murdered, it was brutal, and the murderer was my patient. He had his own self-inflicted wounds. So I needed to treat him and bring him to the hospital. And then 2 years later, I needed to testify. And seeing him again re-traumatized me. And it just progressed so slowly that became my normal. And my family and friends started to realize that I wasn't myself. I would be isolating. My relationship was falling apart. I didn't want anyone to see that there was anything wrong with me, but I was dying, literally.
PTSD and trauma is a family condition. It impacts everybody in that family. And so at Homewood Health, we've been able to create a tailored program that not only meets the individual needs of that client who is seeking services for PTSD, but we're also able to treat the family alongside that person.
The trauma treatment program at the Mississauga Clinic has a comprehensive assessment phase. We want to understand exactly what's going on with the person. Trauma hardly ever comes alone, so we want to know all the ways it's affected the individual and the family. There can be addiction or substance abuse issues, there can be depression and anxiety along with the trauma reactions. It's really important to then base the rest of the treatment on knowing that person, so we can individualize what it is we do for them and make sure we meet all of their needs. You can get immediate access rather than waiting months and months to get into treatment. So you can call us today, get an assessment tomorrow, and start treatment the next day.
So with the Mississauga Clinic, we have been able to create a strength-based group program for clients who may present with PTSD or trauma-related symptoms. And what makes our program different is that it's a staged program. So the client will come in from the assessment stage and they'll stay with us right through to aftercare, which will be a minimum of 52 weeks. So staged process really means we're teaching the client some stabilization techniques to stabilize the condition before we move them into the integration phase, which is really about where the person will make sense and the impact of that trauma for them. We then have a family component, and so the family program will be psychoeducational information sharing for families to learn, what are the symptoms of PTSD, what triggers those symptoms, and how they can help their loved one, how they can, help with those coping strategies. So if you suspect that you've got some of the symptoms of PTSD and you're not sure what to do or where to go, give Homewood Health a call and we'll navigate that for you. We'll do an assessment and we'll determine what your needs are, and we're here to help you.
Homewood helped me, number one, accept that I was sick and that I had an injury, and to not put myself down about that. The doctors and the counselors and nurses, so many of them have gone through a lot of the same things that the patients or clients have gone through. Again, it's just that familiarization that you're looking at me and you get it means everything to me. So I finally knew that I wasn't alone when I was at Homewood.